Let's start off today. We kind of already asked Bernetta how her voting event went. But I kind of want to have a discussion about the voting registration, talk a little bit about census. Dr. Evelyn, if you can update us on the police task force. I know you guys had a meeting yesterday that I was not able to get in on, so I'm excited for that update. And then we're going to talk about if you all received those documents in your email that summarized the meeting from last week and what all the groups said and did in their groups. We're going to go over that. If you did not get that in your email, please include that on the chat, and I think Mark will shoot the document over to you so you can have it. Depending on how many people we get, we may just have an open conversation today. If we start to get a lot of people coming in a little later, then we'll probably break into groups and talk about it so everybody can have a chance to get their voice heard. So we'll just kind of play that by ear when we get to that point. So, voting. Bernetta, you were saying that y'all didn't have that big of a turnout, but y'all were competing with the Buy Black event that went on Saturday on Quindaro, which was amazing. I'm just gonna say
it was. I had the opportunity to go through and stop at some of the different vendors and whatnot. But what we did was we did advertise some, through Facebook and friends and family, different ones and whatnot. And we passed out flyers at the vendor booths, as they were getting set up. So, and asked them if they knew or if anyone, needed to register that they can come down, because we were just like literally right there by them, the church is.
Wow.
I'm sorry?
I said you are right there next to them.
Yeah. So we had a couple of people that came through, but most of them that I encountered was saying that they were already registered, which is a good thing. So that's how that went.
Yeah. So I do know, speaking of the Buy Black event, I know that they're gearing up for another one, and they're doing registrations and stuff for that now. So so Mark is saying in the chat that if anyone didn't get the trauma-informed policy document that I sent out, please share your email address. He'll get it to you. And you could just drop it in the chat. But they're getting ready to do another one. So I know Diane and Lauren have been working with one of our community members on locations for voter registration drives. And any updates on that?
So mostly this work has been accomplished by Lauren. I have been kind of off the grid, sorry. But Lauren's been working hard. I don't think she's on this call, but she's spoken to several different places. And right now, I know she's looking at some of the residential towers, the high rises. And Chandra had a couple of good suggestions for us too. So I'm going to reach back out to Lauren and see how I can help offer contacting property managers or the building managers to see if we can set up some kind of in-person voting. Then she also had an idea about a drive-through, which we had talked about for an event a couple of weeks ago. So I think that might be another possibility to have a drive-through, which might make it a little easier as well. But I do think the more we advertise going to the Wyandotte or kansasvotes.org is how people can also register if they're not already registered, or the Wyandotte County election website also. So
do we need to just get something that has that website on it that we can hand out to people?
Yes, we could. That would be good. So yeah, that would help too if they have access. I mean, the first choice would be to help them register right here and right as soon as we see them, because then they're interested. The focus is on registration, and if we can get them right there, that's the best thing to do. But that's not always possible, I understand. So yeah, something with the website or even the actual papers, but then they'd have to mail them or drop them off at the election office. So, the steps, the more steps we can eliminate, the better. So how were you guys doing it before? Were you doing paper and then we were dropping them off over at election office? How has it worked in the past couple of drives that you've seen?
I haven't personally been able to be at any of the drives, but I think prior to this, they were doing both. Some people were able to have the laptop set up, and if they didn't have a connection, then they have the paper option available.
Okay.
Am I right with that, Bernetta? With what you?
Yes.
So
Yeah.
did you have a laptop set up, Bernetta, at the?
We did not. We did not have a laptop set up, but we did have the applications, the voter registrations applications, and then I turned those in on Monday.
Very good. Okay.
That we got.
That's what I've always done too, because then you have the document in here. So that's perfect.
So I am working on getting a tent because it was hot Saturday, and I don't do good in heat. So for Live and Thrive to have a tent and for Chandra to be sitting underneath it, have a table, we're gonna have a tent.
Yeah.
Where I will get sick and all that kind of stuff. So I'm working on getting one of those, and then we can have like a to the laptop there and use like a hotspot.
Yeah.
For registration. If that's possible. I know they had a couple of booths that were giving out registration information.
Mm-hmm.
But if we can help people do that right then and there, that would be great. So I'll talk to them about that and see what we can do. Any other suggestions from anyone else on here of locations for voter registration or any information? Kim, go ahead, Bernetta.
Oh, I do want to mention information that needs to be publicized or talked about a little bit more is the felon. When individuals think that they're felons and think that they cannot vote, so we could just have some information about that, or if on the flyers or whatever that you may have, because a lot of people that are felons think that they cannot vote, but it really depends on the type of felon that they have. So that is a lot of misconception about felons. If you just say, I'm a felon and I can't vote, which is really not true. So just to kind of talk about that some more would be great.
Okay.
Yeah, I've really been trying to bring that up when I have that conversation a lot. Just go register. That's really all that they have to do to get back in good graces, so to speak, if you want to put it that way. So
yep.
So there we are with that. Also, and I'll go ahead and talk about this, Kim's not on here, but in conjunction with registration, census is very, very important. We're doing better on that, but we need to keep pushing that in everything that we do. So when we have voter registration, I want to have census information there as well for people to, that's pretty lengthy. So that'll be just at least so that they can have the website, know where to go, and know the importance of it. So maybe we need to do like a why this is important type mailer or something, or flyer information that we can hand out.
It seems like there was something on the, and Mark may remember this, is there something on the intranet at the behavior at Wyandotte Mental Health about census and importance of it? It seems like there was a flyer on there for a little while.
I can check.
Yeah, there's it's not a flyer that I don't think it's a flyer we generated. I think there's several different kinds of flyers out there, but I can poke around. I know we put something on the Facebook page too a while back, and I say we didn't generate it, but it's possible Allison did a real quick Canva thing on it. I just, it's been a while. Yeah. But yeah, I'll look into that and see if we can get something kind of semi-attractive going.
That'd be great. So that's voter registration, that's census. Dr. Evelyn, we are ready to hear about this task force situation. What happened at this meeting?
Actually, the mayor really pointed out, he did a good job of pointing out that we are there to listen and to what the constituents here in the county have to say about the relationship they have. It was actually very encouraging. The first thing we talked about wasn't actually us talking. It was, we heard presentations from both the district attorney's office and the interim chief York with the police department. And so the district attorney is requesting, as you know, more funding for the community integrity unit. I'm froze.
You're not
still
frozen.
froze. Okay.
Well,
Maybe she can try without the video.
yeah,
Talk
if you
without
try
the
without the video, try without the video, because sometimes there's too much going on in your thing.
Okay. You don't want to see me. It's okay. I'm not taking it personal.
No, I love seeing you, but I know how mine works sometimes, and if I take, that's why I really have my picture up.
No problem. It's okay. So
After you be done talking, we want to see you, but right now we need to hear about the task force situation.
yes, there you go. So the first presentation was District Attorney Mark Dupree, and he gave out very interesting information. He started out with how America was built on the hands of slaves and the labor of slaves, and how down through the years there has been unjust and unfair practices done with people of color. And then he said, bringing it up to the George Floyd incident that happened, now we have an opportunity to address some of these issues, how the community integrity unit would actually be an opportunity to build more trust between the community and the police department. So he did a very good presentation, introduced his budget. He would like to get several more staff hired to actually participate in the community integrity unit. And the UG is considering at some level of funding to put the community integrity in it. Interim Captain York gave his presentation, and he mentioned that they are in the process of purchasing body cams, and those cams should be in sometimes in August, and he's hoping by, I want to say October, everything is functional and in place. And not only will there be body cameras, but cameras on every vehicle. And so he says then there'll have to be an auditor, someone who literally looks at these body cams. And he says it'll be thousands and thousands of hours of video that someone will have to look at and make sure that the police officers are following protocol, policies. And so that was one of the things he shared. He also shared that there's a wellness officer now that is to be there for the mental health of the officers, and even like classes for spouses, because it's difficult for spouses to understand what the police officers are going through. So, and they also talked about the training. It's two different training for the new experienced officers. And he mentioned that the training for the experienced officers, piece of that will be shared with the new cadets, but only after they've been on staff for a year. Then they'll experience some of the heavier training that goes on. And he mentioned the bias training, cultural competency training, so various different types of training that our police department is required to learn. And it is accredited. He gave us the accreditation, which was CALEA, Now, what that means, I don't really remember, but I did write that part down for the credentials. And another piece that he shared, which was really interesting, was that many of the police officers are very discouraged right through here, the law enforcement. Many are retiring because they think it's not worth it. People don't even understand we're here to help serve. And so there's a little bit
Dr. Evelyn, I think we're losing you a little bit.
disparity there.
Dr. Evelyn,
Uh,
we are
and that you know, they came in with a heart to help, to protect the community, and feel like they're not being appreciated. Okay, all right. Are we better now?
We can hear you. You were talking about, I think when we last heard you, you were talking about some were retiring.
Yeah, they are, many of the police officers are just very discouraged. They feel unappreciated by the throughout the community. And the last thing I want to share is Sheriff Ash asked the UG to potentially do something for the mental health of the police officers. Another bucket of funding that might be used. He gave an example of how the police were devastated finding that 3-year-old baby the other day, and how it really affected most of the team that was out there. And that it would be just so nice to have somewhere they could go, not necessarily, you know, like the insurance that we have, you can go to their mental health thing, but he's saying something else where they can find some services that's funded by the UG to help when they see they're experiencing trauma after trauma after trauma. So so it kind of gave me a different viewpoint of both sides, because I have my own view of different things, but this kind of helped me see a whole nother side. So that, I hope you can still hear me. That kind of ends my report, but I'm happy to do any questions. Oh, by the way, that's on the UG website too. You can go in and see that.
Okay. Cool.
Can I show my face now?
Yes, you can show your face. Thank you.
I wanted to,
there she is. She's so beautiful, everybody. So, we did have a couple of questions. Kathleen asked, does the police use mental health corresponders? This has been a successful program nationwide. And I believe that's what you were talking about when you were talking about the wellness officers, kind of what they were using in place of mental health workers. Is that what they're trying to do? But
the police,
a mental health professional there, though. So I don't know if they were trained in that or not.
Yeah, Chandra, the co-responder program is where.
Sheriff Ash was.
Oh, I'm sorry, Evelyn, go ahead. Oh, she's froze. The co-responder program is where the police can request a mental health professional to come out with them on a call when they think there's a mental health issue in interacting with the community. So it's more about an interface rather than a mentally ill person just having a justice person. They also have a mental health expert that's there and can often de-escalate a situation so you don't end up with something happening that you don't want to have happen.
yeah, and I may add that, and I am not sure if at the moment Wyandotte Behavioral Health has a co-responder in the police department. I know for a long time, beginning 5-6 years ago, they were really, there was some emerging really good cooperation between Wyandotte and the police department, and they had a full-time co-responder and I think maybe a part-time one. I mean, it wasn't enough to cover the need, but they were beginning. They had written a SAMHSA grant, or I think it was a SAMHSA grant to get more. They didn't get it. But there was a time when Wyandotte brought together the entire social service, mental health, and law enforcement community. This was back when Pete was still the CEO, and they put together a plan. Randy would know what this is, and that plan, I don't know where it stands right now, but that was.
Mark, not to interrupt you, I apologize, but I know that we are starting to move into training with government departments like KDHE and different government entities are asking and requesting trauma training, and I'm working on some of that as we speak now. So
that's an important part of, and even back then, I'm just providing this because there's a lot of history there in terms of that cooperation between mental health and law enforcement, and it hasn't been perfect, and it hasn't always worked the way we would want it to, but there have been, for years, lots of conversations going on, and largely, I think, from Wyandotte's perspective, they would probably be described as relatively positive. They've always aimed to keep the channels of communication open. But anyway, that's the just in response to what you were asking about.
I have a question with regards to the police and experiencing trauma. Is there any reason why there aren't or there isn't a program for trained peer support within the officers that they can receive peer support services? Because I know that they were looking for something outside of behavioral health, and there's a variety of reasons for that. I've spoken with officers, especially on this side of the line, that they're scared of losing their jobs when they go to someone on their insurance and admit, hey, I'm having these issues. There have been officers that admit, I thought I was having a heart attack, and they were having anxiety attacks on the job. Is there a way that that kind of program could be started, facilitated, and funded? I know I already have peer support specialists. Wyandotte Behavioral Health has peer support specialists. We have a peer support specialist training program in the state of Kansas. I'm trying to start up working with veterans. I mean, we could possibly even train and pair veterans with currently working police officers to provide peer support. I mean, there's a number of things that could be done to, because I'm so down with the defund initiative. I really am, because they are doing things that are outside of what they're supposed to be doing. But at the same time, these people are humans. And whether they remain police officers or not, even if they do retire, they still have to live the rest of their entire human lives interacting with other humans and family, and possibly carrying mental scars and PTSD and different things of that nature. What can we possibly do as an initiative to help these people who are going to have to human after this job?
I think it would be a great idea, because actually Sheriff Ash is on our steering committee, and I think it would be a great idea to bring him to the table and to propose some of these things, and to set up a meeting to see how this can be implemented. I think the peer support is just an awesome ideal, because there is a fear of them losing their jobs, even though there are ramifications and statutes of privacy and ethics and things that go with therapists, and it's still that underlying fear that plays out in many organizations, really, if you go to the insurance dubbed, because when you're hired by an organization, you can still, in some practices of mental health, give that organization some information, and that is what they are afraid of. So I totally understand that. I think peer support would be awesome. I can actually I'll shoot an email to Sheriff Ash about that to see if he would be willing to join us in that conversation to kind of find some things outside of funding, because Sherry, you're already funded to do that. And but still, more funding is always great to enlarge that territory, you know. So we'll have to look into that and see what we can do. Dr. Evelyn, did you have any comments on what?
I thought it was a great response from Sherry. And what I will do also, I took notes about the peer support and how you would be willing to train in that area. And so I will take that back as part of my comments, because at the end of whatever we're doing, so obviously I'm challenged with knowing how things are going to happen at the end with the task force. But what Mayor did say is if we have questions or comments, we're going to compile them and be able to confront or at least have another face-to-face conversation with the law enforcement personnel. And this will be maybe one of my suggestions, or not my suggestion, but a suggestion that came from the community to provide a service or help to the police.
I really think that would be awesome. And I do want to make this point, and it's not a popular point. Let me say that before I even say it, but who cares? So the fact that I know we talk about racial trauma in regards to how it affects minority communities, but even how it does affect the police department and the vicarious trauma that they have and the fear that they have. A lot of what we see happens to be trauma responses. So when they see somebody, even racially, because those ideologies have been passed down, as unhealthy as they are, and how as unfortunate as they are, and some of it is hate crime and some of it is straight out of their vicarious trauma response. So being aware of that and the mental health that they carry, that in and of itself could help a lot of this, in getting them that kind of support could help us, one, recognize if there is a danger with a person, an officer who has been overexposed to trauma or overexposed to different behaviors that are not healthy for our community. And then two, it is very, it could help with some of the civil unrest. Let me say that. So, Mark, you were getting ready to say something?
Yeah, I think along the lines of offering any kind of training or thinking about peer support embedded within the police department, those kinds of things, it might be a good idea to kind of circle back and connect with Christine Swenson at Wyandotte Center or Randy to see what is going on right now. I mean, I know they're not at this table, but their relationship with law enforcement is just ongoing, and it would be a good idea probably to see what they are seeing are the needs expressed by both the police department and other law enforcement agencies, and also to see how we're stepping up to meet those needs, either with training or co-responders or what. So I would just suggest doing that. And then also the Alive and Well, and before that when it was Trauma Matters KC. So again, kind of a little history, the effort to kind of bring trauma-informed training to the police department, a lot of times the first step that I remember folks focusing on wasn't so much offering trauma-informed training so that officers could be more, sensitive to the public, but so they could recognize trauma within themselves and begin supporting each other. And this would go with all first responders, not just police officers, because they see horrific things, like you mentioned, Evelyn, the 3-year-old, and KCK, they encounter a lot. I mean, just even a traffic accident is gonna. I mean, there's a lot of bottling up of stuff because it's part of the job. You have to hold it together and and just tough it through is the kind of the attitude. But providing something, and I don't know how you do it, but again, if you check with Wyandotte or some other, maybe Marsha Morgan, she's been real involved, closely working with law enforcement and KC Mo at least. those people would know, kind of give you a sense of where things are when it comes to offering that trauma-informed training for officers. I think that would be something to think about as well.
So I know we're not talking directly about the document right now, but I feel like we're digging all in the policing part of the document. I think that this is a good start when we start addressing those policies and bringing those things to the table that even were mentioned in that document that the policing piece group brought up last week. So yeah, this is good. I think when we talk about the people that need to be at the table, we need the sheriff and the DA. We had DA at the table last week, but we need to make sure that they're both involved in these type of conversations. So Donna, thank you for that information. If you all read on the chat, she was talking about the DA Dupree is working with Vera Institute of Justice, a nonprofit dedicated to improving the justice system, promoting equity and fairness, and helping to strengthen communities. And they're doing different interviews in the community. So maybe we can team up with them to make sure that this lens that we're coming up with for trauma-informed care matches what they're saying, and that they're hearing the voice of the community and some of the things that we're asking. So it really is about good health overall for everyone. So that's good stuff. Dr. Evelyn, I think we had like another question on here. Is there a justice team at Wyandotte Center that provides support when requested? Or there is one. I don't know, Diane, that they are as active right now.
Okay, I wondered, it was Jeff, because I worked with them a little bit. They were part of the crisis team. And so there's a team at the Adult Center, Wyandotte Center, and there was also a team at PACES for the children and youth. So,
okay, I don't want to speak out of turn, so I'm not completely sure, but I'll check into that. But again, I think that goes into not wanting to speak directly to therapists that are covered under insurance with the agencies. I think that kind of goes directly to that.
Well, and Chandra, it might also be, to Mark's point, in Johnson County, our CMHC, which is equivalent to Wyandotte Behavioral Health Network, they work directly. They actually have a position at every police department at every city, and they pay for that position. And that position is that co-responder. So it would be interesting to see if Wyandotte Behavioral Health Network has ever, or if they've been approached. But it's a national program. It has amazing results. It's not just here in this county, it's national. And Wyandotte Behavioral Health Network would be the individual that hired, or the entity that hired the social worker. That social worker is then embedded in the police department. And when the police get a phone call where it appears there's a mentally ill person, they go with them, and they are often the individual that de-escalates the situation so that the individual may not end up getting arrested, but rather get the helping care that they need and keep the situation from escalating to something more serious, and that individual being put at high risk and the police being put at high risk because of mentally ill individual. And it's just been nationally across the country successful, and helped police not have to deal with a mentally ill individual because they don't get enough training to do that when they go out. So kind of to the point of shifting resources from just hiring officers to officers and mental health people going out together in the community.
Yeah, and that's why Wyandotte, like I was saying, did do that and fairly robustly given their resources. It's just I don't know where it stands now. I'm pretty sure there's a position on the books for it if it's not filled, if it isn't actually filled. That's why connecting with Christine would be a good idea to see where that stands. And in terms of advocacy, that would be something in budget kind of thing. I know you said that the CMHC pays for it, but I think I think, oh, you're saying the police, the law enforcement paid for it.
Law enforcement.
Okay, yeah.
Actually, the position sits in the mental health center budget,
Mhm.
sits in there as a
Right.
person, but the police provide the dollars to pay.
Right.
I believe.
And I think that you're right. I think that is how it worked here. But yeah, I'd check with Christine to find out what the latest is on that and what the plans are for growing it if those discussions have begun.
Awesome. Sounds good to me. Any other comments on this piece? Thank you, Dr. Evelyn, for being our eyes and ears with this task force situation. I will say I'm encouraged by what you said and by the steps that they even are thinking about taking. I mean, any sign that there can be change is encouraging. So let's see how this plays out, right? And then we'll see how we can infiltrate the camp to help it play out, so to speak. So we have Donna. I don't know. Thank you for being on the call today. I don't know if you're there. Would you have a few seconds just to kind of hit on the heat report real quick, or should we table that to another time?
I am here, and the heat report is about a 65-page report, a study that was done. It was released in 2016, so the data is a little outdated, but we're working with UMKC to see if we can produce some additional data sets based off the original document to update the data. But the data is still very valid when it comes to painting a picture of health inequities in Wyandotte County and why they exist. The report highlights a number of health inequities specifically related to things like average age of death disparities, fetal and infant mortality rates, all of the things that I'm sure all of you are very familiar with. If you haven't read the report, you can download it for free at wearewyandotte.com. There's also interactive versions of all of the maps that are contained inside the heat report at that webpage. And so you can zoom in, zoom out, click on specific census tracts to gain a better picture of what's happening specifically in that neighborhood. There's also one overlay that, as we talk about race and racial inequities when it comes to health and health outcomes, where you can overlay the neighborhood and the health outcomes with the predominant race of each neighborhood. So you can really demonstrate from a data perspective the burden that is placed on communities that have minoritized identities, the burden that they carry when it comes to health inequities. And so it's a great resource for grant making. It's a great resource for having conversations about racial inequities and linking those things back to policy, because the report does that, links it back to redlining as one specific policy, but there are a number listed that really shaped the way neighborhoods look in Wyandotte County today, and why the health outcomes are what they are in those neighborhoods. I can do a longer presentation at another time if people are interested, but all of the information is readily available. There's also some accompanying documents. There's a couple of comic books that are great for referencing, to have conversations about how people interpret the comics and linking that back to policy. And then there are a number of videos as well that speak to sort of summarizing what's in that report. Rachel Jefferson is the kind of the spokesperson in the videos and does just a remarkable job of highlighting what's in the reports. They're very brief videos. Just a note on the Vera Institute, Chandra, I am going to do a email introduction for you with Marisi, who's the qualitative researcher for Vera's community engagement efforts. Looks like it's a qualitative research project to try to really build on the importance, I'm sure the importance of CEI and the importance of a lot of the things that's being discussed on this call. So I think it's incredibly relevant, and I think it would be powerful for anyone that's in this group to be a part of those discussions. So Chandra, I'll send this to you and then I'll let you share it with the group as you decide to do.
Thank you.
Yeah.
Thank you.
Sure.
So when we are talking about our groups, and so again, we last week broke out into focuses on health and mental health, education, juvenile justice, and policing. All of those practices, I think the HEAT report will be a very good reference as to the give like a good historical context as to why some of the changes we are wanting to see are necessary. So I encourage each person in every group to check that out. Thank you, Donna, for putting that in the chat for the website to check it out. So I think it'll be a good guide for some of our conversation. And again, a lot of this is giving us the context, the language, the things that we need. So when we are ready to really go into this work and go into the policies and request change, stand before commissioners, stand before whoever we need to stand before to get whatever we need to get done, we have the language for it and we know exactly what we're asking for and why we're asking for it. A lot of times the reasons why a lot of the organized efforts do not work is because information isn't properly disseminated and people start talking and then they don't know what they're talking about. So it's a process. This is a process. So I know that we may have had some that started with us that wanted things to happen that day, and it doesn't work like that. It took a while for people to start waking up to the injustices. I mean, people always knew they were there, but it took a while for people to admit for the world on such a level that this is what is happening. So the process to undo this work goes back generations. So it's going to take a little bit, but we have to be strategic and we have to be intentional. We have to be focused and we have to know what we're talking about when we come to the table, period. And we have to know why we're talking about it. So that's why this is taking such a process. And that's why this is taking, that's why every week we're trying to get more and more information. So by the time we actually say, okay, let's address peer support for the police officers, we have the history, we know why, we know where it's coming from, and we have all our ducks in a row, right? So did everybody get the form emailed to them that Kathleen so graciously put together for us with all of the notes from last week's groups? Does everybody have that? If you don't, you can put your email in the chat and Mark will shoot it out to you real quick. These are the questions that we want to make sure that we address while we're looking at this document. One, we want to make sure that the document is understandable, readable, and usable. The goal is that all of this is put out to the public. Nothing that we do is going to be anything that we're just doing on our own, but it's going to be something that we want the public very much involved in as much as possible, as much as they want to be involved in. But the reason why we want to create like a central task force for this is, of course, if you have a whole lot of cooks in the kitchen, then you just end up with some weird kind of tasting soup that's really weird and it don't work. So we're trying to make it so that there is an actual group of us that are saying, okay, this works, this doesn't work, but also is hearing what everyone else is saying. So it's kind of set up like the task force that the mayor did. This one is just made up of the community and it has the community voice incorporated into it. So everything that we do, we want to keep in mind that Wyandotte County has an 8th grade average reading level, so we want to make sure that everything we do is understandable. The information can be translated. We have people that can do that into different languages. So we want to incorporate as many voices as we can at the table. What is missing? If you looked at it, we want to address that. What needs to be edited or rephrased? And where do we need to dig deeper to pull from and then customize for WyCo? So I'm going to copy these questions and put them in the chat so everybody can be aware of them and kind of keep them in mind because they're going to guide the next part of this conversation. Any first thoughts, any initial thoughts regarding the document that you all read, if you all had time to look over it?
So I think one of the things that will help is editing eventually. I know there's some groups have really a lot of detail on a few points, and other groups just had a list. You know, I did a list as the recorder, but I know there was more detail to include. But I do think that the groups, especially I know for mental health and health, will need to get back together again and probably do some more inquiry about specific players who are already, who we think are already involved in policy setting or at least proposing policy. But we need to do a double check or inquiry with those groups to see exactly where they are with things, or if they're even willing. What is their status as far as those policies? Just a thought.
Okay. Anyone else? So I was excited when I saw what everyone did. I think everyone did an awesome job. All the groups did a great job of pulling things out that needed to be looked at and discussed, and even also talking about people that need to be at the table. Uniformity is what we want for this document, so that we can, so everyone knows what comes next, what is. So as much as we can make how each group reports out uniform, I think it'll be a little bit easier for people to read and understand and kind of just go to where they're looking for. Any other initial thoughts? Okay. So for the first part of this is kind of what we were thinking about just in our wrap up for those of us who were involved in the wrap up. The vision really is about the community taking this on as its own project and really being aware of it at all times. The group meeting on a regular basis, so that it's more preventative. And I say this all the time, more preventative than reactionary. So we're constantly looking at policy. We're constantly looking at these 4 areas to see what's going right, what needs some change to happen. So we're not waiting till the last minute saying that policy was ignored and things didn't happen the way we thought that they should happen. But we want to be 2 steps ahead of whatever this is. Also, if we have this policy checklist for other organizations, for our government entities to look at when they're building policies or when they're bringing different things to the table, then that would help a lot as well. So it could probably help them become more proactive when they're looking at different things as well. So in this, I'm imagining, and your feedback is welcome, that we would need people who don't mind doing the research. And by research, I mean people who don't mind researching policies, where to get certain things, who to talk to, where to go, that kind of thing. We need communication. What communication works? How do we get the communication out to the community? And then how do we mobilize? So 1, how do we inform the community? How do we mobilize the community? And then influence. This is just being realistic of how things operate, knowing who has the connections, who has the money, who's pulling the purse strings, getting certain things done, and how we build relationships in those areas as well. What table do we need to be at to know to make the right connections, to make these changes? Can anyone add anything else to this, or do you all agree with this? Give me a little bit of feedback on that. Does this make sense?
Well, I think that again, it's still a draft. I do think those are the 4 main areas you're talking about, the four skills: research,
Mm-hmm.
communication. So I think that's the starting point. I think certainly the actions that I guess some of them do have actions underneath of them, but I think the more we look at it, it'll become clearer. I just think people always shy away from the word research. So I wonder, I mean, research is important to me, but I mean, it kind of freaks people out. So, so I don't know, but I like keeping that in there. I don't know, to me, I think it's a very good first draft. A lot of energy and thought has gone into it. But I want people to know that it does need more discussion and more fleshing, I guess, really putting some specifics down or action-oriented pieces. I think that's just my opinion.
I totally agree, because like you said, this is a rough draft, but so if we can kind of group think, what are some of those actions that need to go into this? What are some of the steps that we need to add into these? That's what we need to be fleshing out in these meetings. Anyone have anything for that? Okay.
I might as we go, but it's gonna. So if we could put it later, that would be great.
No, that's fine. I really want this on your mind. If you're thinking about this, if you have ideas, you can shoot them to myself. You can shoot them to Kathleen, because she's going to be creating this document and fleshing it out a little bit more. And any edits that people may have, she will be able to go into a little bit better, and add those in there. So just put this stuff on your mind if you don't have comments right now, and then shoot us your comments. So when we start looking at the criteria for trauma-informed policy, of course, we want to build this out a lot more, but think through, who will this policy secondarily affect? Is the language inclusive? Does it exclude certain groups? We're going to look at the SAMHSA guidelines around what is trauma-informed, and that includes the safety, trustworthiness, transparency, peer support, collaboration, empowerment, and choice. Does it meet these? Is it communicated in a language that everyone can understand? Again, that goes back to knowing the grade level of our community. And what is the policy? Is the policy available in a diverse set of languages? So we know for Wyandotte County, most of the languages are, the most used languages are Spanish and English. So, but we also know we have a huge Burmese population, huge, we have a whole lot of populations in Wyandotte County that we need language for. Providing it in those areas, especially when those policies inform them of what's going on in their own community. So, who's in the room? We talk about that a lot. And we must understand everything in a policy. This came from last week as well, when we talk about that they don't say everything explicitly in a policy. So being able to read between the lines in that as well, and knowing what everything says, small print, the big print, the medium print, all of that. So anybody would add to this or want us to look into for this list? Are you guys okay with this list?
Chandra, this is Kathleen. Just in typing this, we had just a few minutes in the last call for people to kind of brainstorm. Mm-hmm. I wonder out loud if we might want just a small little sub-team. Mark has sent this last week. I have not had the time to look at it. He sent like 3 documents from I think really from more national organizations that have done some work around trauma-informed policy. So I don't know how much, like it would be nice to have a group that kind of looked at that, but then made it very, customized it to Wyandotte County. So anyway, I wonder about, how to really push forward on this thinking, and can we use some of those insights from the documents that Mark has found, you know, since our last meeting on Wednesday, to make this a bit more robust, since this was just a quick brainstorm at the last meeting by people, you know, kind of top of the head reflections, which are amazing, and then could be supplemented through, you know, what others have done in this area. So that's just one of my reflections when I was typing it and pulling the notes together from the last meeting.
Hey, also, I like that idea, Kathleen. I think it would be good to have maybe a smaller, more nimble group working on a lot of the nuts and bolts and stuff, and then use the larger group to kind of get feedback once we have this together. I also have to apologize. I had not scrolled down on my screen to see that several people had requested the document, so that could be explaining some of the silence. I'm going to be sending that out right now.
This basically is a big capture of what we talked about last week.
Mhm.
And you just really want to see if there's anything anyone immediately wants to add to it or not. Also, Kathleen, going along with Kathleen's ideal, if there are those of you who are wanting to be a part of a smaller group that helps flesh all of this out to bring to the bigger group, then that would be great. That would be helpful. You can put that in the group chat as well if you want to do that, or you can just shoot me an email about that. So I'm gonna go through it. So then we have the focus policy areas again. We've talked about those: education, health, and mental justice, juvenile justice, and policing. And then you all were given these 3 questions last week in your different groups to talk about. So what I want to encourage everyone to do, and I know we probably just need some more time to go over the document and just to kind of think about it, let it sit, let it marinate. But I want everyone, I don't want to take up everyone's time just reading to you all what's on here. But if everyone can take some time, look through this document. If you have suggestions or edits, shoot them to Kathleen, please. Kathleen, can you put your email in the chat for us again? And if you're interested in being part of a smaller group to work on this, you can shoot me an email or either put it in the chat. Either way. So since everyone doesn't have it, and I really want us to really think about this, think it through, get into it. I think I'm gonna give you guys a week to let it sit. And again, if you have ideas and you don't want to forget them, shoot it to me. Thanks, Shakita. I think the small group is a good idea. So those of you who are saying you're interested, we'll get with you and get some time scheduled to do that. Probably not before next week. We'll do the whole group next week and talk about it. We also have Wesley from UUG who is going to come and talk about how they're dealing with their policies and how they're developing them and addressing them. And Mark, what else is he going to talk on?
Well, Wesley Mccain is the director of Healthy Communities Wyandotte, which is kind of a physical health corollary to what we do. Really, they're about building a coalition of organizations to tackle important health issues, and they have a policy committee that they've put together. I think it's been up and running for three, maybe 4 years, and so they have a lot of experience there in terms of just organizing themselves, setting a policy agenda, and then probably the most important, interesting thing that he can talk to is just how exactly they go about their advocacy work, because that's real messy whenever you work in coalitions. So yeah, so Wesley will be with us. We've also reached out to Daniel Silva at the KCK Chamber to see if he might be interested in talking about their policy work. but I have not heard back from him yet.
And I think this is very important so that we know what other organizations are doing. So one, so we're not duplicating things, but then also if we need to partner with them to give them the trauma lens a little bit better. So some of our people may need to join with them and sit with them just to kind of go through things and make sure that that everything is lining up. I think this would be a really great group to tap in for that information. So the more that we can support other people doing it and make sure that we're all on the same page, using the same language, I think the more uniform our community will be when it comes to policy change. So not that we want to duplicate the government way of doing anything, but we still need to, again, be aware of what they're doing so we know the approaches that we need to take as a community as well, right?
That's right.
So, so yeah, that's what we'll do. We'll table this so you all can have enough time to really look at this document and really go over it, see what you see, get ideas. Even if it's not your group that you're working in, please provide ideas because a lot of us work in different sectors at one time. I know I'm on some groups and I'm in like every group that they have just because every group needs a trauma lens, so to speak. So don't limit it to just the main group that you work with. Provide information across the board. And then that group will focus on that as we move forward. Any questions or anything for me?
Chandra, I don't have a question, but I do want to just tell you a little bit more about the task force and opportunity. One of the things that will be available on the UG website under the task force is anyone can go in and do a video of themselves and talk about their experience. I think it's 3 to 5 minutes you'll have to talk about that experience with the police officer. And they have a set of rules that the individual who wants to do that can do. And then they forward on to the task force, and then the task force takes a look at it. And then that's part of what we will confront with the different entities, enforcement entities, at the end of this whole experience, which I think the mayor said sometimes in September. So I'm still just a little foggy on some things, but I do remember that website will be available for those who do video expressing their concerns or experience with the police department. Thank you.
Any other comments? Are we okay with the process that we're taking? Any suggestions on the process that we're taking? Any confusion? Okay. Well, I'm excited because I think that this is getting some legs, and I think that pretty soon we're going to be in position to really be a force to be reckoned with as far as when these policies are being made in our community and providing voice to it. And I think it's a really empowering experience for our community to do some things and get some things done. Diane, did you have something to say?
I just wondered, talking about the small groups, how soon will the small groups need to meet again? Or I know it's got to come from the bigger group here. But
let's do that. Let's have that conversation next week.
Okay.
In our next Wednesday meeting, after we've talked about this, after we talk to Wesley a little bit, and then we can start probably trying to figure out what that looks like. Because again, I don't want to create more meetings for people. So even if that means that we do breakout groups here, everybody just meets here during this time, and we do breakout groups, then we'll do that as much as possible. And then if the groups themselves decide that they want to meet on the side to accomplish what they need to accomplish, then they'll be able to have the freedom to schedule that. But I don't want to create more work. Everybody on here has a lot going on already, have, a lot of meetings. Some of us Zoom all day, every day. And so I don't want to add anything else to that plate unless we have to. Okay. All right, everyone. If that is all, I'm going to say thank you so much. Please, please, please review the document. If you work with people in the community, please encourage them to be part of these Zooms. We really need community voice. We need as many people as possible because, again, I'm going to treat it like voting. If you don't participate, then don't wait to say anything when it's all done. All right? So we are ready to go. All right?
Thank you.
You all have a great day.
Talk to you later. Bye.
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 Bye.